Burlington United Methodist Family Services Incorporated, changing lives by preventing harm and providing hope and healing to hurting children and families. Burlington United Methodist Family Services began as the Star of Hope Child Refuge, which was founded in October of 1913. Our organization was founded by Dr. F. L. Baker, who is pictured, and Reverend Mr. F. C. Rollman. Our President-CEO is Michael Price Sr. Mike retired from the Air Force on September 8, 1996, and began his tenure with the agency on September 15th. Mike has brought many years of service, starting out as a treatment associate, working closely with the residents. He then worked as a case manager, operations supervisor, program manager, and then as a CQI trainer. In January 2011, he began his role as President-CEO. Mike is honest, compassionate, hardworking, has high moral values, and is well respected at the state level. Eagle Accreditation. Burlington United Methodist Family Services is a member of the United Methodist Association. Our agency is nationally accredited by the United Methodist Association's EAGLE program, which stands for Educational Assessment Guidelines Leading Towards Excellence. This is the only faith-based accrediting body in the world focusing on ministry with older adults and children. Spiritual Life. Chaplains at the Burlington and Beckley campuses work with youth to ensure that spiritual needs are being met. The Spiritual Life program is part of each child's total treatment plan while in our care. Provisions are made in consultations with their guardians and family members for youth from religious backgrounds other than United Methodist to worship in their faith of choice. Available to staff and their families. These are pictures of both our Beckley Chapel and Burlington Chapel. Adoption services include the following: home studies, adoptive parent training, post-placement and post-adoption services, counseling and support services to birth parents and adult adoptees, international, domestic, and special needs adoptions. Community-based therapy, provided to children and adults in our care and throughout the local community. Community engagement envisions healthy communities where integrated resources are accessible for everyone. Helps to achieve wellness, personal goals, and self-directed future. Emphasis is placed on function rather than disability. Located in Pocahontas County. Foster care provides services to children birth to 18 years of age and youth up to 20 years of age if they remain in a school setting. Children may have suffered from abuse and neglect and may have emotional or physical challenges or other circumstances making them unable to live with their family of origin. Children are referred to the program by social service agencies, primarily DHHR. Therapeutic foster care provided. Home finding. State DHHR grant program designed to promote safety, permanency, and well-being to our children who are in need of out-of-home, family-based care. The objective is to increase the number of kinship homes available. Parents as Teachers, otherwise known as PAT, evidence-based home visitation program, serves children and families prenatally through kindergarten, focuses on parent-child interaction, development-centered parenting, and family well-being. PAT is a free service with no income requirements, serving the West Virginia Eastern Panhandle. Beehive, fun-filled inspirational activity center. Families come to build bonds with their children and be inspired by a character-driven environment. Encourages principles such as kindness, love, and empathy. Children play for the first hour and learn how to interact with other children. The second hour, children and their parents work together to complete an activity. Inspires and encourages strong relationships between children and parents in a fun, supportive environment. Located in Martinsburg, West Virginia. Right from the Start, otherwise known as RFTS, free in-home program that serves West Virginia's expectant mothers and infants that are receiving Medicaid. Workers assist the client with learning the skills and resources necessary to ensure health and safety. Workers help clients receive information on childbirth and labor, community resources and support, arranging transportation to medical appointments, housing, and education. Serves as regional lead agency in Regions 2 and 7. Safe at Home, otherwise known as SAH, designed to help bring youth back into their community. SAH works with the family and community to get what is needed to help the family so that the youth will be able to have the services that is needed to keep him or her in the home. Focuses on youth 12 to 17 years of age in congregate care both in and out of state. Sarah's House, which stands for Sexual Abuse Response and Help, a nationally accredited child advocacy center that provides a different way to investigate, prosecute, and treat child abuse. It's child-focused and child-friendly, and victims tell their story one time to help reduce the trauma of continuously reliving the abuse. Social Necessities Services, a service in which visitation between parents and children is observed to evaluate appropriateness and level of interaction. Provider assures there is transportation to and from the supervised visit and may intervene if abuse or inappropriate behavior is occurring. The provider will assess and monitor the appropriateness of family interaction and possible reunification. Staggers Recovery House, federally funded substance abuse grant program administered in conjunction with the West Virginia Bureau for Behavioral Health, provides a 12 to 18-month residential living program for women in recovery. Residents maintain a structured family schedule, attend self-help meetings, perform community service, and obtain goals regarding their education, training, and occupation through a progressive level system. Residents are active participants in their own recovery as well as in the community. Student Attendance Assistance, early prevention of absenteeism. Students may be referred to the school counselor, other student support personnel, student assistance team, mentoring, and/or peer programs for excessive absences. Serves children K through 5th grade and is served in Monongalia County. Targeted Case Management. Assists clients with identifying and obtaining needed services such as mental health treatment, medication, federal and state benefits, housing, etc. Service is provided to children and adults. Located in Oakland, Maryland, and serves all of Garrett County. Youth Services, State DHHR Grant Program. Workers provide assistance with youth that are involved with the court system and/or have behavioral issues in other situations such as home, school, and the community. Youth service workers refer clients and their immediate family to services that can assist in extinguishing inappropriate behaviors. Residential Care and Treatment. Burlington utilizes a holistic team approach to treatment that promotes mental health, spiritual wellness, and behavioral stability required for successful community reintegration. The treatment team assesses the residents, plan, implement, and evaluate care. Treatment includes individual and group therapies, behavioral management, recreation, experiential learning programs, as well as psychiatric and general medical services. On-Ground Schools, funded by the West Virginia Department of Education. Academic and vocational training available at both schools. Residential Level 3 Care. Serves children ages 8 to 18. Provides 24-hour supervision and intensive therapeutic services, and is provided in Reese Headley, Kitzmiller, and Beckley Cottages 1 and 2. Residential Level 2 Care. Serves children ages 12 to 18 and is provided in Beckley Cottage 3, Craig House, and Kaiser Girls Group Home. Residential Level 1 Care. Located in Kaiser, West Virginia. Serves 9 youth ages 16 to 21 and focuses on transitioning to independence. Adolescents with Coexisting Disorders. Serves 8 individuals ages 12 to 17. Adolescents must have an IQ in the 55 to 84 range. All residents attend public schools. Each residence program is individualized and is located in Daniels, West Virginia. Brenda's House, a residential facility serving children 5 to 10 years old with severe behavioral and psychiatric needs, serves children with IQs as low as 55, and the program focuses on behavioral support, stabilization, and permanency planning. Planned giving, bequests, retained life estate arrangement, charitable giving annuities, revocable living trust, life insurance policies, cash, stocks, and pledges. If you would like more information or are interested in our events, please visit our website at www.bumfs.org or visit our Facebook page at www.facebook.com/BUMFS1913, or you can contact our Burlington Administration Building at 304-289-6010.